Tips from the ER. Seizures. Did you know a person can actually feel the moment right before they have a seizure? Oh yeah, they know it's coming, and there's nothing you, me, or anyone else can do to stop it. But what you motherfuckers can do is try to keep them safe. There are a couple types of seizures. Sometimes it's just a blank stare, like this. And sometimes it's a full body vibration that could include some kicking, swinging, and shaking. If that's the case, they're gonna fall to the ground. So catch them, motherfuckers, or they're gonna crack their head open. Once they're on the ground, clear everything around them so they don't hit anything, and protect their head. Don't let their face grind on the ground like that. There's no need to hold their body down or keep them shaking. Just let it happen. It's fine. Once things calm down, turn them to their side so they don't choke on their own spit and wait for them to wake up. They're likely going to be super confused and not remember anything, so let them know they've just waken up in the year 2025. I'm kidding, don't fuck with them assholes. Having a seizure isn't always an ER visit, but if you're unsure, tell Siri to call 911. Tips from the ER. Code pink. If you've already been in the ER for 5 hours getting your finger sewn up because you had a little accident with a kitchen knife, be prepared to be there a little longer. If there's a code pink, we're locking this bitch down. No one's leaving because there's a baby missing. That's right, we couldn't get the slime off of it fast enough before somebody decided your baby was too cute not to take home. Code pink means someone stole a baby or the nurse accidentally gave it to the wrong mother. Either way, we can't find them and we're blaming everybody until the little poop monster shows back up. You can bet I'll be in the hallways looking at you, looking at me, looking for a baby. If you happen to see somebody holding a bundle of blankets with an umbilical cord hanging out of it, notify your nearest hospital personnel. If you happen to be holding a baby, you might get tackled. Even if that baby is yours, we can't take any chances. No hard feelings. Code pink! Tips from the ER. Fainting. If you start to feel dizzy or faint, the first thing you're going to want to do is sit the fuck down. Don't be a hero and try to walk it off, motherfuckers. You're not going to get very far. Sit your ass down, bring your knees up to your chest, and your head down between your knees. This will help circulate blood into your brain, which is likely the reason you're fainting. Don't wait until you pass out standing up, hoping Prince Charming will come catch you. You're going to crack your head on the floor and wake up naked in the ER. If you see someone faint, make sure they're breathing and that they're not injured. If possible, raise their legs up above their heart. We got to get every last drop of blood in that body up to the brain. Once they start to wake, don't stand them up right away, motherfuckers. Just leave their bitch ass on the ground. If you sit them up too quickly, they're just gonna pass out again. If they don't wake up within the first minute or so though, it's time to call an ambulance. Tips from the ER. Choking baby. I know some of you can't stand the sound of a crying baby, but I personally love that noise. It tells me at the very least that baby is alive. If your baby is moving around and its eyes are open but it can't cough, breathe, or make any sounds, that's a sign that your baby might be choking. In which case you're going to want to drop whatever the fuck you're doing, tell Siri to call 911 while you get that no noise making baby face down on your forearm. Support its head with your hand, tilt that sucker down, and smack that baby between the shoulder blades 5 times with the heel of your other hand. Then turn it over, don't drop it. Use 2 fingers to rapidly thrust into the center of the chest another 5 times. Rotate these until whatever's choking your baby falls out. Don't be afraid to be a little rough with the thrusting. Your baby could take it. Don't believe me? Just remember this. If there's one thing worse than a bruised baby, it's a dead baby. Tips from the ER. Clothes off. If you ever come into the ERs, be prepared to show a little skin. We ask you to take your fucking clothes off for many reasons. Better for the doctors to assess you, easier for the nurses to get an IV, and we get to see how hairy you are. Don't worry, it's quarantine season. We won't judge. On the other hand, if you've ever been in a big accident and woke up in the ER, you'll notice that we took the pleasure of taking them off for you with big heavy-duty scissors. What can we say? We like to get you motherfuckers naked and fast. Can't waste time pulling them off you. Our goal is to keep you alive, and we don't want to miss an injury or a bleed hidden somewhere underneath your Sunday's finest. It's painful to have to cut off horseback riding gear, motorcycle gear, or a fancy suit. But hey, if it'll keep you alive, snip snip. Tips from the ER. Burns. 2nd degree. It's what happens when you won't take your hand off the stove fast enough to go run it under cool water. Not ice cold water, cool water. Leave it under cool water for as long as you can. And don't listen to your crazy family members try to talk you into questionable home remedies like mayonnaise, mustard, and toothpaste. Just use cool water. If you don't quickly cool down a burned body part, that heat will travel into the 2nd layer of your skin, turning your 1st degree burn into a 2nd degree burn, making you slightly more fucked. You'll know it's a 2nd degree burn because it's going to start to swell up and blister. But don't pop those blisters, motherfuckers! If you pop those blisters, that area is now an open wound, making it more easily infected and making you slightly more fucked. But if it's already popped, don't you worry. Clean it off with cool water, wrap it up in something loose that won't stick to it, and get your ass down to the ER. We'll make sure it's not that serious, get you some ointment, wrap you back up, and send you back into the wild. Tips from the ER. Thoughts of hurting yourself? If you come to the ER with thoughts of hurting yourself, the first thing we're gonna do, sit you down and take everything away from you. Phones, clothes, necklace, bracelets, anything you could possibly use to hurt yourself, including the bra. We take no chances, motherfucker. If you tell us you're gonna hurt yourself, we will totally believe you. We'll get you a gown, some socks, and someone to keep eyes on you at all times, which means no more private bathroom privileges. Eventually, a specialist will come down to evaluate you and decide if you're safe enough to go home or if you have to check in for a couple days. I won't lie to you, motherfuckers. You will be waiting in the ER a very long time, and you cannot leave unless we say you can. I know this all seems highly inhumane, but the worst case scenario is you go and kill yourself, and we will take every measure possible to prevent that from happening. Because better days are ahead, my friend. I know it's impossible to realize in the moment, but suicide really is a long-term solution to a short-term problem. Tips from the ER. Food poisoning. Some of you have never had to cry, shit, and vomit at the same time, and it shows. Motherfuckers are out here eating warm potato salad and mystery taco meat like it can't kill ya. If you've ever had food poisoning, you know the pain of staying up all night, dry heaving air and shitting water until your ass is on fire. Hopefully you spent a little bit more money for that triple ply Charmin, motherfuckers, because it's gonna burn. Food poisoning sucks, and the only thing you can really do is wait it out. Literally, wait for it to come out of you. Your body will shit, piss, vomit, do whatever it can to push out that dirty piece of meat you put inside of you. But all that pushing will lead to dehydration, so make sure to drink small sips of water between all that crying and pooping. Get some rest, and when you're ready to eat again, start with bland foods like rice, crackers, and toast. If you can't keep anything down and the dehydration gets to a point where you feel like you're one teardrop away from death, you can come on down to the ER. We'll get you an IV and hydrate you through a vein to give your poor tummy a little break. Tips from the ER. Chest pains. If you are 35 or younger and you are experiencing chest pains, it's most likely not a heart attack. Now, I'm not saying it can't happen. If you smoke a pack of cigarettes every day starting at 18, yeah, you'll probably have a heart attack, motherfucker. But if this isn't you, because you're a smart motherfucker, then it's more likely one of these three things. Number one, stress and anxiety, which is easy to understand given the fucked up year we've had. Reason number two, you pull the muscle. It needs rest, maybe some ice. And my favorite, reason number three, you smoke too much weed. Lay off the ganja, it's freaking you out. If you've had chest pains from any one of these three things, comment below. Tell me I'm right, it wasn't a heart attack. If you've had a heart attack before 35, that's wild. Comment below, let's learn about it. Tips from the ER. Code Blue. Ah, yes. If your daily caffeine intake hasn't woken you up yet, a Code Blue certainly will. If you ever hear this over the loudspeakers of a hospital, it means someone somewhere has either stopped breathing or their heart stopped working. Hopefully it isn't you. But if it is, don't you worry. A team of doctors, nurses, respiratory therapists, and whoever else can get their pants on will rush to come find you and bring you back to life. And just like the TV shows, they will run, and fast. So if anyone's in the hallways, get out of the way. Hearing Code Blue in the hallways is like hearing sirens on the streets.